Hi, my name is Susheel Kodali. I'm an associate professor at Columbia University in New York and the director of the Structural Heart and Valve Center, along with my colleague, Dr. Isaac George. So the Evoque is a transcatheter tricuspid valve replacement. It's a self-expanding nitinol frame that has a bioprosthetic valve made of bovine pericardial tissue within it. The device is designed to be delivered transfemorally via 28 French delivery system. And basically, the way the device works is a wire is placed in the RV apex. The device is advanced into the right ventricle, and the valve is slowly exposed, initially exposing some anchors, which engage with the valve and the annulus, and then the device is fully deployed. There are currently three sizes: 44, 48, and 52. And then I said everything is done percutaneously. Clearly, transcatheter therapies for tricuspid regurgitation is an unmet need. There are a lot of patients out there. We know that severe TR results in worse outcomes. These patients generally do not get offered surgery, one, because the indications are not clear, and two, the surgical risks are much higher. Over the last decade, there have been numerous devices that have been looked at as possible transcatheter therapies. There are devices for transcatheter edge-to-edge repair that are in pivotal trials. And those devices have worked, but they have some limitations. Anatomic, meaning the gaps are too big. The location of the jet is difficult to engage. Pacemaker leads are in the way, and other considerations. And especially in those patients, transcatheter tricuspid valve replacement may be a better option, or it may be a better option for the entire cohort, but that's what these ongoing trials are designed to show. But the trial is designed for patients with severe TR that are symptomatic despite optimal medical therapy. The main question is, does fixing and eliminating tricuspid regurgitation, and that's one of the things I forgot to mention earlier, with replacement versus repair techniques, replacement really eliminates TR, whereas replacement, the goal is often to reduce TR. And the question of the TRISCEND II Pivotal Trial is, compared to medical therapy, does replacing the tricuspid valve and eliminating tricuspid regurgitation improve patient outcomes?